Neurosurgery and neurorehabilitation is an extension of neurosurgical treatment.
See, patients with neurosurgical problems may have deficits before surgery, or they may develop fresh deficits after surgery.
The neurosurgery is we are trying to take care of the problem that is causing the neurological issue. In terms, somebody may be having weakness, somebody may be having pain, paralysis due to some cause which can be surgically treated. It may be even a simple clot after an accident. So there the brain and the spinal cord and the nervous tissue all over the body gets injured, and this injury may not be always complete or permanent. So in neurosurgery what we do is we remove the problem. For instance, if there is a tumor which is causing the paralysis or any other issues like hearing loss or vision loss, etc., because all of them are functions of brain.
The most important thing in any surgery for that matter, not functional neurosurgery alone, spine surgery you take, or you take a tumor surgery, whatever, you take any surgery, rehabilitation is extremely important. And rehabilitation means from the psycho rehabilitation, to physical rehabilitation, to occupational rehabilitation, to functional rehabilitation. So rehabilitation is a neglected portion. And now awareness is coming that 50 to 60% you can do something. The remaining percentage, more improvement or maximize the benefit of what you have done, rehabilitation comes in.
So any patient who has a head injury will have some neurological deficits or disabilities that cannot be corrected completely with a neurosurgery or surgeon by itself. That has to be done by neurorehabilitation. So in complete care of head injury or stroke, the neurorehabilitation plays a very vital role and a very important role.
It's like 50% of our job is neurosurgery. The next 50% is neurorehabilitation. It has to go hand in hand, because without neurorehabilitation, how much ever we do and whatever good we do for the patient, without rehabilitation it will be difficult, very difficult for them to manage their daily living.
There are many people who don't know about rehabilitation. Not just rehabilitation, there are many people who don't know about basically the subspecialties of neurosurgery also. So per se, talking about rehabilitation, yes, there is a lot for the people to know. There's a lot that can be done. There's a lot can be achieved, and it can be miraculous.
If those deficits do not resolve, their quality of life will be very poor. For example, if a patient is not able to swallow or speak properly or walk properly, obviously their quality of life is extremely poor. And neurorehabilitation plays a great role in restoring their patients by at least reducing the severity of these deficits or resulting in the complete improvement over a period of 1 month or 2 months of active physiotherapy and rehabilitation.
Once we operate and remove a tumor or a clot or some bleeding spot is controlled, then the nerves and the brain have to recover. It's like very simple. If a vehicle, say for instance a car, is not moved because its engine is not working, then the issues with the tire, etc., axle, and the driving force, all of them could have rusted if you have not used it for some time. Now you do have to overhaul those things as well. And similarly, the limbs which we are rarely concerned, we tell that they are paralyzed because the nerves which make them move are injured. When the nerves are recovering, you have to keep them intact and keep them functional. You keep them lubricated. That is one part of rehabilitation. Other part is person may be having partial weakness, may be having partial injury. During that, we need to support the patient For instance, somebody may be having difficulty in swallowing, somebody may be having difficulty in speaking, somebody may be having difficulty in closing his eyes. All these have to be protected and allow the patient to recover and adjust to the new situation. It's something like somebody, like me, I'm wearing spectacles. So as a child, when I started using, I must be shown how to use it, and afterwards you are very comfortable. Similarly, rehabilitation, the treatment is never complete in neurology or neurosurgery without rehabilitation.
Neurorehabilitation was very primitive, especially Dr. Sharan in neurorehab. He has done a fantastic job. He has very good team with his wife. He is doing great assessment, especially post-injury, post-surgical, whatever residual disabilities are there. He is able to evaluate very effectively and identify the problems in early stage and give a right therapy. He is really working very hard on neuro rehab. Very few centers have a good neuro rehab. It is a lot of background knowledge and good team and supporting equipments. He is able to do real justice to the patients which they would have suffered or they will suffer with the residual say spasticity, deficits and abnormal gait. Many things which we thought it doesn't improve. He could show very good significant improvement in some of the patients.
Like Sharan also has been involved in rehabilitation for the patients of neurology or neurosurgery. He has established a well-running rehabilitation center with multi-modality specialities that are available in one roof, and his better half is involved particularly in the rehabilitation, and he has got all the facilities for his center where a person with stroke, especially neurological illness, stroke, movement disorder, any other neurological illnesses can seek all rehabilitation specialities in one roof, and it is extremely doing very well, and they are dedicated neurorehabilitation people in that center where you can go and get all the rehabilitation answers in a single roof.